Hello. Yesterday, President Joe Biden announced that he will not seek re-election. What do you think led to this decision? There are several possible reasons, but one significant factor was the growing concern over his memory lapses, which became more noticeable since the debate with Trump at the end of June.
By their spouses, brothers and sisters.
This led to many press criticisms about his performance, highlighting his weak and hesitant speech, as well as illogical arguments. Shortly after, during a NATO press conference, Biden made several serious errors, such as confusing the name of Ukrainian President Zelensky with Russian President Putin.
Ladies and gentlemen, President Putin. President Zelensky.
And mistaking his vice president, Kamala Harris, for Trump. But what are memory lapses? And how do they differ from dementia? Today, we will clarify these questions, explaining the differences between memory lapses, mild cognitive impairment, MCI, Alzheimer's dementia, frontotemporal dementia, and other common types of dementia. We will also discuss the initial symptoms and some diseases that can be mistaken for dementia, along with tips on how to prevent memory loss. Before we start, like the video, subscribe to the channel, and share it with your friends and family. When it comes to our health, it's worth sharing. And tell me, have you or someone in your family been experiencing memory loss? Where are you from? Write in the comments. Let's get started. First, let's understand the difference between a memory lapse and dementia. We have all forgotten where we placed our keys or the name of someone we just met. These small slips are normal and can happen due to stress, fatigue, or distraction, known as memory lapses. Dementia, however, is something more serious, a general term for the loss of memory and other important mental abilities that interfere with daily life, caused by damage to neurons that affect their communication. As we age, some cognitive functions decline, especially those that require attention to the environment and quick information processing to solve problems. This decline is expected with aging and can affect memory, executive function, language, attention, and perceptual motor control. However, some people experience a more severe decline, known as mild cognitive impairment, MCI, a stage between normal age-related cognitive decline and dementia. People with MCI have memory, language, thinking, or judgment problems greater than expected for their age, but not severe enough to significantly interfere with daily life. For example, a 70-year-old who frequently forgets important appointments or has difficulty following a complex conversation may have MCI. About 12 to 18% of older adults have this impairment, and approximately 10 to 15% of these people develop dementia each year. It is a warning sign that should be closely monitored. Alzheimer's disease is the most common form of dementia, accounting for 60 to 80% of cases. It is characterized by the progressive death of neurons, leading to a continuous decline in cognitive abilities and memory. The accumulation of beta-amyloid plaques and tau protein tangles in the brain is one of the main features of the disease. Risk factors include advanced age, family history, genetics, and lifestyle. Another important type of dementia is vascular dementia, the second most common form after Alzheimer's, accounting for about 10% of cases. It is caused by small strokes or the narrowing of blood vessels in the brain, reducing blood flow and damaging brain tissue. Symptoms include planning problems, reasoning, judgment, and memory loss. Frontotemporal dementia is a group of disorders caused by the degeneration of the frontal and temporal lobes of the brain, affecting personality, behavior, and language. Symptoms vary but can include drastic changes in personality, inappropriate social behavior, lack of empathy, impulsivity, and speech and language difficulties. This disease affected actor Bruce Willis, whose first symptom was aphasia. The early signs of dementia can be subtle and easily attributed to normal aging, but it is important to be aware of them. Some common early signs include recent memory loss, difficulty planning or solving problems, confusion with time or place, communication problems, mood or personality changes, difficulty performing daily tasks, loss of initiative, impaired judgment, and visual difficulty. Although Biden has shown difficulties with speech and memory, this does not necessarily mean he is experiencing cognitive decline. Chronic stress can negatively affect memory and increase the risk of dementia, and educated people can disguise dementia for longer. However, a formal evaluation is necessary to determine someone's cognitive state. Some medical conditions can mimic dementia, presenting similar symptoms but potentially reversible with proper treatment. These include vitamin B12 deficiency, hypothyroidism, depression, infections, metabolic disorders, medication side effects, brain tumors, and head trauma. While there is no guaranteed way to prevent dementia, studies suggest that lifestyle changes can reduce the risk. staying physically active, adopting a healthy diet, keeping the mind active, getting good sleep, socializing, controlling heart risk factors, avoiding smoking and alcohol, practicing relaxation techniques, and maintaining a healthy environment are some research-based tips. Recent scientific discoveries give us hope that lifestyle changes can not only reduce the risk, but also reverse cognitive decline in the early stages of Alzheimer's. It is never too late to start taking care of your brain. If you liked the video, please like, share, and help others take care of their memory and health. Comment below if you have noticed any of these signs in yourself or a family member. Subscribe to the channel and see you in the next video. Thank you.